I grew up in central Pennsylvania, rural central Pennsylvania. Growing up, I was always fairly active. I played a lot of sports in high school, and then I went on to Penn State, where I wrestled at Penn State. Decided later on to end up pursuing a career in medicine. I'm a DO, which is a doctor of osteopathy, so we're similar but a little bit different practice style or philosophy sometimes than MDs. Still go to medical school, still have all the same kind of training from that aspect, but we kind of learn a little bit more of a holistic approach or whole body approach to people, which is what I kind of like to take into my practice, or what I kind of think I hope to bring into the practice. I specialize in physiatry, which is physical medicine and rehabilitation. It is a rather small medical specialty field. We work very closely with physical therapists and occupational therapists, sometimes speech therapists if they need that, to kind of maximize your functional independence and return to work or return to play or return to just your general day-to-day activities. So the things I really like about Panorama and why I really joined the practice in the first place is it's a really cordial group of individuals, a very large team approach, particularly with our service line with spine and non-operative spine care. At least every other week we have a meeting with just the spine team where we get together and see what is the best course of action, whether we present cases with tough patients or questions about a patient or how to pursue the best course of action, as well as going through case reviews or current research. We also have where everyone gets together, the entire practice, whether they be spine or trauma or hand, and once a month present cases as well as a general lecture as far as for whatever that topic is for that day. So it's very academic. It still keeps you in the loop in a lot of stuff. You get to see different people's perspectives, and I think that's a hard thing to find, especially in a private practice group. So the things I like doing in my free time, I stay pretty active. I like to be outdoors a lot, so whether that be hiking or skiing or kayaking, I like to stay outside. That's why I like Colorado. I'm definitely a big animal lover, so that's a lot of what I spend time. The other thing, my other big passion for both of us is really traveling. Been fortunate enough to have a couple times where I've got to go on some medical missions trips, both to Africa and to Mexico. It's pretty hard to beat the rewarding aspects of working in especially a third world country and bringing that same aspect back to here and just learning from those experiences is hard to beat. So.